Hello everyone, welcome to Within the Frame. I'm Kim Bo-kyung. Patients are worrying about potential disruption to medical services as more than 6,400 trainee doctors from 100 hospitals in the country submitted their resignations. And around 1,600 have already walked off the job as of late Monday night. The government has vowed to take any measures available under law, even revoking the doctors' licenses while preparing an emergency medical system. This doctor backlash comes as they oppose the government's plan to raise the medical school enrollment quota by 2,000 starting next year. The Yoon administration is quite stern, though, saying such an increase is very much needed to address the shortage of doctors, especially in rural areas and essential medical fields. Today, Within the Frame has invited doctors to ask about their views on this issue. We invite Dr. Alice Tan, an internist from MizMedi Women's Hospital. Dr. Tan, good to see you again.
Thank you for having me.
And we also have Professor Son Ho-jun from Seoul National University. Welcome to the show, Professor Son.
Thanks for having me.
All right, first things first, Dr. Tan. So more than half of trainee doctors nationwide submitted letters of resignation, and some have already stopped working. Now, will more doctors follow their colleagues? And I hear there was a meeting this afternoon among the trainee doctors who have resigned. What did they discuss?
Right, so this is an unfortunate situation, obviously. My understanding is the meeting this afternoon involved organization, designating leadership for the striking interns and residents. Also, there was a conversation about speaking with legal experts so that they can have a framework for legal protection in the actions that they'll be taking. It does appear that doctors in training are getting ready for the long haul. My understanding among medical professionals is we don't desire a confrontational approach. We would like to come to a mutually acceptable solution. On the other hand, when doctors feel completely ignored in terms of their expert opinions and input into medical issues involving the health of the nation, it becomes very frustrating for doctors in dealing with government officials who are politicians, but of course they're not health professionals.
I see. So they are currently feeling ignored and maybe they are getting ready for a long fight. Now, Professor Son, in response to such a doctor's decision, the government has pledged to take stern measures, with the health ministry already ordering them to return to work. And it also added that it will take strict legal action, such as revoking doctors' licenses. How are doctors viewing this warning?
Yeah, so let's put this into context of other professionals, right? And I don't think how physicians are responding to this issue is not so different from other professional communities, say elementary teachers, nurses, and factory workers. The reason I say this is that physicians in general, this message from the government is being threatened for their profession, their passion for their jobs, as well as their well-being and their status, right? And when other professional community are being threatened in a similar way, I don't think they will be responding any differently as what doctors are doing. What doctors feel and what the community feels is that it's important. The important message and issue is being ignored, especially that when government comes out and issues these threatening notes, it really contradicts the government's overall goal in improving physician shortage issues, especially in the essential medicine, and an overall goal to improve healthcare workforce supply, right? If the government actually takes the actions to revoke licenses of, let's say, right now 6,000 or so residents in physicians in training, this immediately results in 6,000 to 7,000 physician shortage immediately for foreseeable future, right? So it's really a double-edged sword at this point, and it's not just the physician's perspective that's being only considered here.
All right, I see your point. Now, we definitely need to talk about how this doctor's walkout is having an impact on patients and hospitals as well right now. I hear, Dr. Tan, hospitals are already rescheduling appointments and delaying some surgical operations. How much of an impact is this strike expected to have?
Well, hospitals are obviously prioritizing urgent, emergent cases in the operating theaters above elective cases. Um, we should understand that hospitals, doctors, healthcare workers, our first priority has always been and will always be the needs of our patients. Whether these needs are short-term or looking midterm or long-term, decades down the line, that's always been our priority. And when communication breaks down, when words are not heeded or listened to, then action needs to be taken. But I think for people who have elective cases, less urgent cases, they can expect that their surgeries may be postponed. But overall, I don't think that this will impact, say, immediate life and death, limb-threatening, life-threatening cases. We will not be abandoning our patients by any means, but we do want the government officials to understand just how serious and passionately we feel about this very important issue. And when words aren't enough, actions need to be taken.
Right, I see. I totally understand how doctors feel about their patients and how they always prioritize their patients. But as the schedules, some of the schedules are being postponed, already some of the patients and their families are lodging complaints over the doctor's decision, Professor Son. How are doctors reacting to this?
Yeah, as Dr. Tan pointed out, doctors are not in a business to just take care of their own personal well-being and financial gains, right? They're really the primary objective of physicians and the medical community in general is to take care of patients, and they're definitely concerned about the physician's well-being and the issues that are being brought up. One thing I want to quickly point out here is that doctors are not ignoring this public opinion, right? And it's not appropriate for us to, and for us as in general public to understand that this is a doctor against our citizens and general population in Korea. It's actually an issue between physician community and the government decision-making process that does not fully have considered the opinions that's been raised and issues that's been raised by the physician community. It just feels like to me, as someone who's not directly involved in this, that the issues that's being portrayed in the public is that the doctors are holding patients and the general community hostage to achieve their goal. It's not really that. So it's important to note that physicians are taking care of this, understand the issues of the public opinion, but they're not holding this against it on their strike issue. In terms of, we will talk more about it later, I guess, but, physicians do really understand that the patients are not in favor of current actions of the strikes. And as Dr. Tan has pointed out, the physician general community are really taking priority for urgent care so that none of the patients have to go through catastrophic issue during the strike.
Right, I see. Well, Professor Son, it seems that you are trying to underline that this is not a fight against patients, but rather fight against government's decision-making process. But Professor Son, it's government's responsibility to prepare for all possible scenarios. And the government is currently planning to activate an emergency treatment system, maintaining 24-hour operations at hospitals with emergency rooms and opening military hospitals to the public as well. But for how long do you believe this will be able to hold up the system?
Well, as we've experienced during COVID times, right, emergency system is only meant to be operating on a temporary basis. If this strike goes on for more than a month, I think this will be a very catastrophic issue for both the patients as well as well-being of all the physicians in our community. It's going to be, we're going to be for sure immediately facing the main issue of the doctor shortage. So it needs to be resolved as soon as possible. Again, emergency situation and operations are not meant to operate for more than a month. And so we made plans for at least a couple of weeks and at least a month in full, but anything beyond that will be putting significant stress on the system.
All right, I see. So it needs to be resolved within this month. Now, Professor Sohn, up until now, we have been talking about how doctors' collective action is having an impact on the system, but we need to notice that such fierce opposition was fundamentally due to the government's plan to increase the admission quota for medical schools by 2,000. Now, the government said this is part of efforts to prevent the collapse of essential regional health care, but how are doctors seeing the planned increase of this by, 2,000?
Yeah, the 2,000 number is very interesting. But it's not just one particular report saying that, but it's also just a number that's been proposed without significant evidence that's being backed. The other issue that we think is important that's not being widely spoken in the community and in the general public is that to implement this 2,000 increase in new medical students next year immediately, right, poses significant stress on medical schools. This 2,000 represents 2/3 increase, right, of current quota of medical students that's being accepted. And on average, that means 40 additional new students per school. And all of the schools, as far as I know, cannot accommodate this big of a change in student quota. And what many of the doctors who are pro for implementing increase in medical school admission was that they were thinking about around 500 increase per year, and then this will be gradually implemented based on how things go with this new increase in admissions. These things need to take time, and we know for a fact that many of the countries like Japan, who have increased the medical school quota, has implemented these things, increase in admissions gradually over time. 2,000 in 1 year and immediately next year is significant challenge for medical schools to handle at this time.
All right, I see. Now, before I move on to the next question, I'd like to notice our viewers that because of the screen issue, we have our Dr. Alice Tan on the phone. And so we're going to continue this question to our Dr. Tan. Now, Dr. Tan, our Professor Sohn already pointed out that there are going to be much stress on medical schools because of this increase in the number of, enrollment quota. But some, as our Professor Sohn already pointed out, worry that this is going to lead to a fall of the education quality. And to this, the government reportedly said that it is going to ensure more adjunct professors for national medical schools. But is this a plausible idea?
Well, using clinical teaching attendings to help teach doctors in training and also medical school students, it's nothing new. I think it's a plausible plan. This could offload some of the pressure and responsibilities that are currently on professors who have to manage not only clinical duties, but also research and also teaching. And there are some professors who may not like teaching. They may prefer being physician researchers. And so having teaching attendings who are from the community, who are very committed to their role as teachers can certainly help. But in this regard, you talked about medical quality, and I think this is one issue that is a glaring, we might say, a blind spot in the policy that's been set up so far, that was published in early February. In other words, we need to delineate, we need to define very clearly what makes quality medical education. What defines quality medical education? What defines quality medical care? What are the indicators that we are looking for and that we will be measuring? Because if we are looking to make changes, we want to know, is the result of the change better than the situation we started with? And if we do not have these objective indicators to guide us in terms of our decision-making process and how we may potentially in the future modify our plan, it's really, I think, starting with lack of preparation. And I completely agree with Dr. Sohn in terms of it's a matter of timing. It's a matter of the order of the steps that need to be taken. It's a matter of the magnitude of the steps that have been proposed. I mean, for the last 2-3 decades, it's widely known that the quality of medical care in South Korea has significantly improved. Why? When the population is clearly shrinking, dramatically shrinking, would you increase after 2 to 3 decades of no change? When the population is shrinking, why now increase the quota by 65%? It defies logic in terms of the timing and the order and the magnitude of the change that's being proposed.
All right, so it seems there must have been some of the blind spots that the government was not able to consider. Professor Sohn, after the announcement, though, the government came up with a package of incentives for the medical community, including laying a legal foundation to limit doctors' criminal liability as a part of appeasement. But what were the details of the package exactly, and why couldn't this package persuade doctors eventually?
Yeah, I would not put this as an incentive, but this is one of the 4 major areas of 2024 medical care reform plans. In this medical accident safety net, I guess we would translate into English, this plan proposed to protect both the physicians from frivolous medical lawsuits and burden associated with potential criminal charges and investigation resulting from medical accidents. So this proposed strategy includes introduction of special law that can reduce the risk of criminal allegations and exemption from charges that may be associated with medical accidents in areas of essential medical services. There are additional protective measures that include strengthening mandatory medical malpractice insurance coverage and medical malpractice investigation process to ensure that physicians are not facing significant financial and process burdens. It also includes 100% coverage for patients who are involved from government compensation programs who may be involved in medical accidents that are not found to be at fault by physicians. Previously, it was 70%, so essentially physicians who've been involved in these medical accidents who are found not guilty still had to pay about 30% in this amount. Initially, it's important to say that physicians welcome this change, and it's a positive change. But as I explained at the beginning, it's one of the few packages, right, and plans that overall arching goal to improve medical services and improve the coverage of the essential medical services in the rural and limited areas. So it's hard to say, and it's inappropriate to say this is that physicians are not happy because this is just the only incentive package.
All right, I see your point. Now, before I wrap up this show, I'd like to ask this question to Dr. Tam, because you talked about the blind spots the government might not have been able to consider. Though each stance could be different, the country surely needs some kind of reform to deal with shortage in doctors in regional areas and for essential medical fields. So in what direction should the reform policy go, in your opinion?
In my opinion, we need to draw up a nationwide demographic map that specifically identifies each region in terms of the population, the number of women of childbearing age, the age and the sex makeup of each community. Then we need to find the catchment areas of the hospitals that are currently running and see if we can provide access to the communities in the rural areas with the resources that we have currently. This needs to be mapped out very clearly. And then we need to figure out what balance between affordability, efficiency, and accessibility we want to strike. This needs to be defined and agreed upon. And then this plan needs to be designed from the beginning in a collaborative way with medical professionals at the table as principal stakeholders in the discussion, to be confronted with a plan and say, hey, go and do it as a command isn't really a collaborative approach. And as I said, doctors are the experts in terms of taking care of the health of the nation. And so I believe they need to have a stronger voice in designing a plan that makes sense. And once we define what is the problem, where is the problem, how do we want to come up with the solution, what sort of transportation infrastructure do we need, what sort of information sharing infrastructure do we need? As I talked about the quality indicators, we have a shrinking population that is aging as well. How are we going to address these future medical needs, including dementia, home health care? These are all issues that are looming on the near horizon that really haven't been addressed. All we're talking about is just very small pinpoint issues. So I think we need to go back to the drawing board. Go back to the table, everyone sit down and be willing to negotiate, because otherwise it's the health of the nation that can be harmed potentially if we don't negotiate and collaborate.
All right, I see. So drawing up this clear demographic map and having much more communication between the government and the doctors group would be necessary. All right, well, I'd like to ask many more questions to our experts, but unfortunately, this is all the time we have for today's edition. Thank you, Dr. Tan and Professor Sohn, for your time and insights today. We really appreciate it.
Thank you.
All right, that's all for Within the Frame tonight. Thank you for watching, and goodbye.